Greetings. My name is Wayne Sorenson. I'm a project manager with the Family Health Center of Marshfield Incorporated. I want to thank the Portage County AODA Coalition for asking me to share some information on recovery supportive workplaces, which is an initiative that is part of the Central Wisconsin Partnership for Recovery. First, a little bit about the Family Health Center of Marshfield. We're a federally qualified health center, or also considered a community health center. Either one of the terms is appropriate and defines what we do. We serve rural, underserved communities in central, northern, and western Wisconsin. We've been a partner with the Marshfield Clinic Health System since 1974, and moving forward this spring, we are going to have an affiliate connection with Marshfield Clinic Health Systems as we operate more independently as most FQHCs do. The FHC Community Board prioritized these activities and have resulted in service lines that we make available in our area. First was dental care, which was established in 2002. We offer locations in 10 different communities in the service area you see in the map to the right. In 2016, we added substance use disorder treatment, starting with a location in Minocqua and then adding centers in both Marshfield and Ladysmith. And as of 2022, we are initiating primary care services, starting with mobile units. A little bit about the Central Wisconsin Partnership for Recovery, or CWPR. It was formed in 2019 and works to reduce the prevalence of substance use disorder through prevention, treatment, and recovery programming for residents living in Clark and Wood County. It was funded through the Health Resources and Services Administration, or HRSA, which is part of the U.S. Department of Health and Human Services. And the grant program is called the Rural Communities Opioid Response Program, or RCORP. The project actually started in 2019 with a planning grant where constituents from over 24 agencies with over 40 individuals participating in a number of focus groups that identified needs and gaps in both Clark and Wood County. And as you can see below, they identified 4 different focus areas, one being targeted youth intervention, another being jail discharge planning, a safe and sober housing, and a peer recovery support initiative, which includes a recovery supportive workplace program. The actual work for the initiative started in September of 2020, and the grant will conclude in August of 2023. The genesis of the recovery supportive, or often called recovery friendly workplace, comes from 2 primary sources, but there are a number of others that are comparable to the information that we utilize to frame our program. First, we utilized a definition from the Wisconsin State Council on Alcohol and Other Drug Abuse, Substance Misuse in the Wisconsin Workplace report that was distributed in 2019. In that report, SCAOTA calls employer supportive or employee friendly workplaces places where employers develop an organizational culture that promotes health, wellness, and addresses substance use prevention, treatment, and recovery among its employees. The other program that we evaluated as a resource for our program was the New Hampshire Recovery Friendly Workplace Initiative. And they define their program as recognizing recovery from substance use disorder as a strength, and by being willing to work intentionally with people in recovery, employers encourage a healthy and safe environment where employers, employees, and communities can collaborate to create positive change and eliminate barriers. As I mentioned, these 2 drove the framework for our program, but there are a number of other statewide initiatives that are really, really, really good. I would encourage you to check them out. Wisconsin doesn't have a governor's level sort of program as other states do. But in addition to the CWPR program, there are other areas at the grassroots level creating these programs, including a new initiative in the Marinette area, as well as 2 recovery community organizations in the state that provide recovery supportive or recovery friendly workplace consultation to help businesses that are interested in making that change. As I mentioned, for the purposes of this project, we focused on the New Hampshire and SCAOTA reports, but there are a number of others would encourage you to check out, including programs in Connecticut, Pennsylvania, and Nevada that, again, come from the governor's office and are really extensive and provide great resources for anybody interested in creating a program of this nature. Regardless of the program, the state, or the report, there are 5 key common components to a recovery-friendly or recovery-supportive workplace program. And I'll use supportive and friendly interchangeably for the purposes of the program in Central Wisconsin. We call it recovery-supportive workplaces. The first is employer commitment. And that means that from the top down, and decision makers, owners, board members, all commit to making changes and implementing policies and practices that support current employees in recovery, become a recruiting tool for individuals in recovery who are looking for meaningful employment. Employee readiness. The expectation is that a company that is looking to initiate a recovery-friendly or recovery-supportive workplace does a self-assessment, takes a look at the policies and practices and procedures that they have as part of the process. Training for leaders and employees. So from the top down, trainings on fundamental knowledge about substance use disorder, including Substance Use 101 to help people understand current trends in substance use disorder. Things like stigma reduction, things like pathways to recovery, trainings on community resources to support employees in recovery. These are all critical pieces of information that a company will want to know as they look to make changes in their practice and procedure. Company policies and culture, evaluating the language they use in materials, evaluating the social activities that are sponsored by the company, the culture, what do people do after hours and how is that communicated inside the workplace? And finally, community partnerships. Engaging with folks that work with individuals in recovery, engaging with recovery community organizations, engaging with supports and resources, whether that's through an EAP program or local substance use providers, to strengthen the connection to resources that can be used to support their employees. I want to dive a little bit deeper into each one of these. Employer commitment. It starts with a statement to all employees showing commitment that the company or the business is going to support employees in recovery, both existing and new employees. It's a statement that is shared in multiple venues and platforms, so it's clear and penetrates the entire organization and is a clear message when the company or agency looks to recruit new employees. Train organizational leaders, executive management, human resources on SUD-related topics. I listed some of those already. It also includes ongoing training. So not just a one and done sort of approach, that there are yearly trainings for organizational leaders on the most current topics related to substance use disorder. And finally, assess and make changes to support current and new employees in the recovery. And that starts with onboarding, that starts with ongoing expected or required training for employees, that they are a yearly basis that they receive training related to trends. It demonstrates a willingness to make the appropriate changes that support all employees. Employee training. Again, as I mentioned before, it starts with leadership. It sets the tone by making sure that executives, managers, supervisors, human resources, line directors, folks that are seeing or overseeing people in an employment, or excuse me, in a business, have this specific training and understanding of what it means to be an employee in recovery. Pre-employment training and onboarding. Again, building in substance use disorder fundamentals, basics, and resources as part of the package that individuals get before they start or when they start. Existing employees and yearly training. As I mentioned, it becomes part of the annual training plan. The trends change. Resources change. So it's really critical for employees and businesses that are committed to being recovery supportive to stay current in terms of trends and topics. Company policies and practices. Starts with assessing current practices, including employee drug screening. To encourage companies to consider the purpose of their employee screening, whether that's pre-employment, post-accident, ongoing random. Is it done because of a state or federal regulation related to the work that they do? And more importantly, how are the results used? We want to make sure that folks at least consider that because, again, in some cases, the screening process can be a stigmatizing sort of activity for individuals. Workload nature of the job. In some of the meetings we've had with businesses, that has come up. You know, the thing that we want companies to consider is it a reasonable expectation for someone with a substance use diagnosis to work in a particular type of work or a type of job? We often have the opportunity to remind folks that substance use disorder is a medical disease. And so there are some things to consider in terms of ADA considerations and accommodations that they would make for an employee with some other sort of diagnosis. Flexibility in schedules for employees to attend meetings and treatment appointments. Partners that we work with in our Alcohol and Drug Recovery Center often talk about the challenges to maintain recovery due to inability to get to things like meetings, whether that's AA or NA, or appointments with their counselor or therapist. So we encourage employers to consider what kind of flexibility in a schedule they might be able to create for someone in recovery to attend these meetings. And again, utilizing the premise that substance use disorder is a diagnosed disease, to consider the same consideration for anybody that is getting treatment or seeing a counselor for substance use disorder as other diagnosed diseases that someone might present to an HR office. Supervisor support and understanding of SUD and recovery. Again, what we want to do is create a common knowledge base for anybody in a company, and in particular those that supervise individuals who are in recovery, so they have a good foundational knowledge of what it means to be in recovery, what it means to have to seek support, and what it means to seek services. Insurance plans and employee assistance programs, if they're offered, and that's not always a case for every company, but does the insurance company provide for behavioral health counseling? If there's an EAP program, what are the resources that are available to employees that might be impacted by substance use disorder, and how do they access it? Keep in mind, this isn't a comprehensive list, but it's pretty consistent between the programs in multiple states, as well as the recommendations from SCAOTA. Finally, stigma and other employee-related SUD, and this is where the ongoing training is critical. The language that we use matters. And again, the importance of person-centered language, person-first language is critical, both in documentation from a workplace, manuals and the like, and the language that people use on the workspace. Finally, access to peer support specialists and recovery coaches. We want to be able to provide opportunities for businesses to have access to peer professionals who can provide additional support and training both for employees and individuals in recovery. Community partnerships. It's important to connect with local service providers and recovery community organizations for engaging and partnering with that community to provide and make available additional resources. Training on current topics like understanding substance use disorder, pathways to recovery, stigma, and supporting families impacted by substance use disorders. And I think that is a bit of an understated part of the program, is making sure from a holistic standpoint that the resources available in recovery support of a recovery-friendly workplace take into consideration not only the employee, but the employee's immediate family, connected friends and family, and anybody that might have some connection to that employee. ADA compliance training, again, because substance use disorder is a diagnosed medical condition, it's important to remind companies of the importance of ensuring that someone with a diagnosed substance use disorder is receiving comparable considerations under ADA. Evidence-based practices, and I know that's a kind of a jargony term, but providing companies that are interested in making these changes with resources that have been researched, that have been assessed, and that have evidence of success and impact. And again, recovery coaching and peer support in the workplace, it could be as simple as having a peer support specialist, a recovery coach available for consultation with a business, whether that's the HR office or a manager, as the case may be. I think it's critical to make sure that there is a connection with peer professionals and employees in recovery to maintain that connection to resources, to maintain that connection to the recovery network. This has been suggested in a couple different states, but the idea of perhaps offering support meetings on site, either AA or NA, and I know in some rural areas it can be a bit of a challenge to have access to those meetings. The other piece of that could be virtual meetings that are available for folks. Why should a company hire people in recovery? In the current labor market that we're in, one of the things that's really, really important that we've been sharing with businesses is how valuable and how unique someone in recovery is, and the skills and the experiences that they bring to the table. Employees in recovery are uniquely skilled. They have lived experience that can be assets to employers. They're loyal. In some of the research that we've done as we developed our recovery supportive workplace program is that those that have actively and intentionally hired people from the recovery community often note that individuals have a tendency to stay longer. And in today's environment where the churning of the workforce is a constant issue, this is actually a cost savings measure to hire people that are more likely to stay, because the cost to constantly hire, train, and then replace employees is significant to businesses, especially small businesses. Reliable, less likely to call in sick from overusing substances. Again, in looking at a business's bottom line in the return on investment, the opportunity to have folks that show up to work and work hard every day and come in excited and not in any way, shape, or form impacted by any of their behavior the night before. Hardworking. Recovery's hard. Working through recovery on a daily basis, it takes a lot of effort, and that translates into the workplace. Engaged and ready to learn. I think that's pretty self-explanatory. People in recovery demonstrate an interest in learning new things, new skills, new opportunities, new ways to maintain their sobriety and to take things differently than they used to. One of the things we want to share with companies is that employers who create a workplace environment that supports recovery can access a pipeline of dedicated employees. And again, as the market has cooled a little bit, companies were really struggling to keep employees, to fill positions, and I fully believe that employers are missing out on an incredible potential candidate pool from the recovery community. And I think the opportunity to make some adjustments in work that allows them to access that pool, I think will help them in their bottom line and put them in a competitive advantage, perhaps from their competitors who aren't. What I'm showing you is an example of a flyer that we make available to people who might be interested in learning more about the Central Wisconsin Partnership for Recovery and Recovery Supportive Workplace initiatives. As I mentioned earlier, right now we're focusing in both Clark and Wood counties, but Portage County is part of another coalition that we work with called the Hope Consortium in the Central Region. So there will be opportunities, we hope, to expand this in the future. As I mentioned, recovery supportive or recovery friendly workplaces. Our program goal is to provide support services and increase recovery support in the workplace through this particular program. And what we want to do is partner with businesses to become recovery supportive. And part of that is to provide them resources, connect them with agencies, and expand peer support in workplaces. I want to share with you just briefly some of the resources that we utilize to put this program and this presentation together. I want to share my contact information if you're interested in learning more or for additional resources. I've also added Melanie Kretschmer, who is our program assistant, has been remarkably integral in helping us create this program. So I want to thank you for your time. Don't hesitate to reach out with questions, and I wish you the very best of days.